welcome to Tech Talks, the People and Planet podcast. Today, I'm joined by Jim Song, the CEO of Aphora Health. Jim, hi, how are you?
I'm doing great. Thank you. Nice meeting you, Lee.
Nice to meet you also. Really interested in learning more about this. I think it's a really important topic, and one probably that a lot of people, it's quite a popular thing, and I'm sure we'll go into this shortly, but it's all about access and affordability to healthcare without compromising on the quality. Tell us more. What's the problem that you guys solve with the company mission, and what inspired you to go on that mission?
Yeah, so for me, I worked on the both provider side and the payer side. I worked at NYU Langone Medical Center, really with the clinical leadership, trying to figure out how we can improve quality for patient care. I was there for about 7 years. And then I went to work for Blue Cross, more on the payer side, looking at how we can reduce cost of healthcare, looking at it from the premium perspective, looking at it from case perspective, looking at all the data, especially a lot of actuarial data. And it was really eye-opening for me. And one of the biggest concerns that we've been facing in the US has been, the epidemic of continuously increased in healthcare costs. And it hasn't gone down. In fact, it's gone up. It was just announced that it's going to be 12.4% higher for average employer across the US. And I find that amazing. It's like, competition of healthcare should drive the prices down as you see more of it, because healthcare quality has gone up so much globally. And so I looked at how can we tap into that? How can we leverage the incredible capabilities, not just in the US, but globally, to be able to bring that value to everybody in the US on the employer side.
Got it. So Jim, do we know why it keeps going up? You mentioned 12.4% there. That's a huge increase.
There's a lot. I mean, when we looked at this, when I was doing a lot of research, the healthcare in the US is expensive. Number one, there's a lot of labor cost arbitrage in other countries, certainly. But it's just the way our medical system is designed today. A typical, I'll give an example, a typical surgeon may make 5-6% of that surgical procedures, and rest goes to the hospital, the OR, the rooms, and everything else in between. And so when you look at the cost of what we get in the US and where all the money is going, it doesn't surprise me why it's so expensive. And the frightening thing is when you do have a situation where you have to undergo a very expensive surgery, your bill doesn't usually stop there. You wind up getting another bill like 3 months later. It's like, what is this? I got another $2,000 bill. And it continues to surprise you. So even the transparency of billing is a surprise. And it's a surprise to employees and employers. And the other thing is deductibles for employees are extremely high in many cases, depending on the kind of plan that you have. You can have a co-sharing plan, 80-20, 70-30. You can have a very high deductible plan where you have to meet out of pocket $6,000, $7,000 when you need a surgery. And average Americans can't afford that. And when you look at the average median income of people in the US, and I could share that screen real quick, you'll see that on average, the median income is $74,000. It's actually come down from 78 to 74 from 2020 to 2022. But this is the reason why healthcare is not affordable. And on top of that, it's not very accessible. If you ever try to see a specialist, you may have to wait 3, 4, 5 months. And that's a problem we're trying to solve.
Got it. Okay, a huge problem. So talk us through the product itself then. How does that work to solve this problem?
Yeah, so what we do is we work with top global providers globally. And I really believe the most important thing is the outcome of the patient. No matter how cheap it is, it has to be of the highest quality.
Sure.
And there's 3 products. There's the global surgery product for folks who need very expensive surgery that may require hospitalization. Then there's also specialty medication product where some of these medications can go between couple thousand a month, all the way up to tens of thousands of dollars a month. You'd be surprised to, I was shocked when I found out some of these drugs are costing an employer 20, 30,000 a month, resulting to 300,000 a year for one employee. And it's not very often. It's usually 1 to 2% of employees that fall in that category. But when it does, it's very detrimental to the employer. And it's also very difficult for employees with copays. And the third
That's
product,
huge, isn't it? I mean, if it's a smaller business,
yeah.
if you're looking at a couple of 100,000 going out on medical bills, then that's serious numbers, right?
In fact, 1 to 2% of those folks will make up 50% of pharmacy spend.
Wow. Wow, wow, wow.
It's shocking when you look at the data. And if you consider 1 to 2% of an employee, let's say you have 1,000 employees, that could be literally 10 people, 10 to 20 people in your company that are on the most expensive specialty meds could be costing you up to 50% of all pharmacy spend of your entire 1,000 employee group. That's amazing.
Yeah, it really is. It really is. Sorry, I cut you off there. Tell me about the other products.
So the last product is for non-covered electives. There's a lot of procedures that are not covered by insurance. Things like cosmetic surgery, cosmetic dentistry. Doing a full mouth restoration could cost you tens of thousands of dollars. IVF is also very expensive in the U.S. I've heard as high as $30,000 to $50,000 for IVF in the U.S. And also, when you look at everyday drugs, we have a product called Aphora RX, just AphoraRx.com. We compete with some of the big names out there I won't mention, but you should be able to get everyday drugs at dollars, right? And in fact, I love the fact that when I use it myself, the drug that I get for whether it's blood pressure medication or what have you, for a 90-day supply, I pay less than my deductible. So I'm like, this is great. I can just go on the website, AphorArx.com, plug in my medication, tells me which pharmacy locally I can go to get it. And I get it for like literally cheaper than my deductible itself. So then you kind of wonder, why is the system so broke? Why isn't this available to everybody consistently, transparently? So we're all about transparency of cost, making sure that everybody understands what the cost is, and to be able to bring that lowest cost value, but at the same time, preserving the quality. When you talk about specialty medications, we only deal with FDA approved process drugs. And so again, goes always all the way back to the quality of aspect of healthcare.
Yeah, it really does. So let me get this straight then. So an employer would sign up to Aphora, and one of their employees, I don't know if this is typical, but let's say a replacement knee, I'd imagine would probably be quite a costly surgery. And then through that plan, I would, if I needed the new knee, I could go internationally, and all of that would be covered in terms of the travel and the accommodation whilst you're there, the surgery, and then getting you back to the States.
Yeah, there's multiple aspects. So when you look at the history of medical tourism, people have gone overseas to save cost. Employers have done it, and there's a lot of employers that are doing it today. The biggest challenge isn't getting the surgery itself. The biggest challenge is making sure that surgery that was performed is highest quality and there is continuity of care. There's continuity of care that's absolutely essential in my view, because when you come back and there's problems, we want to be there for you. So the whole life cycle ecosystem of beginning, during to the recovery process is all covered under Aphora. So you mentioned, yes. So if an employer signs up, we identify employees that may need certain procedures, and it may not be all of them. I mean, there are some lower cost procedures that are just better off getting it done here. But for the very expensive ones, we can not only save employers a very significant amount of claims payment, but our goal is to reduce or eliminate the copay for employees. Now, if they have a $4,000, $5,000, $6,000 out-of-pocket copay, that's a lot of money savings. And as I showed, if you're making $78,000 average household income with after taxes and your children and so forth, it could be very difficult. And a lot of people wind up deferring their surgeries and just getting a cortisone shot for pain and just dealing with it until it gets so bad you have to get it done. And when you choose to do it, our model is a complete white glove service. Somebody comes pick you up, car service, you go to the airport, all the arrangements made for you and your partner, your spouse, significant other so that they travel with you as well. And while they're traveling, we also make sure that they have healthcare coverage, and we're partnered with a company to provide that insurance coverage as well. And when you come back, and so that covers the entire flight, the hotel, the accommodations. And when you come back, our navigator then continues to follow up with you to make sure everything went well. And if there's a post-operative follow-up that you need to have done here, then we find the local provider here that will see you. So we partner also with local providers. And in some cases, some of these procedures we may just refer you to a local provider,
Sure.
like a local orthopedic centers and so forth. But there are certain surgeries where it's so expensive, and they're more lower in numbers, but when they occur, it's detrimental to the employer. And so that's where we want to help the employer, help the employees, reduce the cost. Hopefully, this will reduce the cost of premiums because a lot of these employers are self-funded employers. So,
Yes. Yeah.
while they may have Cigna, Aetna, United, Blue Crosses of the world to access their network, when it comes to paying for the claims, they're paying out of pocket. And that's where it gets very expensive for them.
Absolutely. Absolutely. And I think, just going back to your, your sticking point on the quality. This is not just about affordability and access. This is about quality. And I think it's super important because we've all heard the press, we've all heard the stories of people going to various places to get specifically cosmetic surgery off their own back done, and it going not the way that they wanted it to, let's put it that way.
Right. So I share this one slide is because one of the things that I really believe in is around quality. So we have a chief medical officer who's an MD. All our navigators are either, clinical professionals. Our pharmacy program is run by pharmacists. And it's our job to make sure we compare quality and US benchmarks with KPIs, with looking at a lot of the CMS data, looking at the outcome data, readmission rates. So above and beyond all of this, every provider that we send our employee to are curated. I visited just about every facility out there, literally, with our team. We look at their clinical workflows. We look at their barcode administration, how they're doing it, how are they administering medications, how their clinical operations work. So we review a lot, and got a great team. And that's one of the things I learned a lot when I was at NYU, making NYU one of the top quality was the fact that we have such a stringent process on the clinical side to make sure that that the quality aspect is there. And I want to make sure that that level of scrutiny is there when we send any employees, that they can rest assured is trusted. And that's why we only send them also to hospitals we have direct contracting with. So there's full coverage, quality guarantees, indemnifications, and so forth. So we won't send anybody to a hospital system that we don't have a direct contract with. And that's also very important. We want to make sure there's not only the level of quality and outcome, but there's accountability. So if something does go wrong, and this is what's broken down in medical tourism, something goes wrong, you're kind of on your own. But with us, you just come back to us. And I'll talk a little bit about what the future holds for Aphora, because there's a lot here that that we want to continue to do great things in the space.
Yeah, definitely. You've touched on this already in terms of your background, but just give us a quick recap on how it's led to you, starting Aphora.
So I came to this country when I was really young with my parents from South Korea. I think I was 6.5, 7 years old. I grew up without health insurance myself, so I know what it's like when you're sick and you got to pay out of pocket, how expensive it is. My parents, they were entrepreneurs. So we had our own business. I was helping them run their business at a very young age. And I enjoyed every minute of it. But at the same time, it was very difficult. And when I graduated college, I got my first job. I felt, okay, I have insurance now. I can afford it. I still found myself, I can't afford it because out of pocket for deductible was like $5,000 at the time or whatever it was. And I was like, I'm only making like, I don't know what I was making, but it was really low. Plus I had student loans to pay, et cetera, et cetera. I'm like, I'm gonna have to wait a couple more years. So I wound up waiting another 1.5 years, 2 years to get the surgery that I needed, even when I had insurance.
Well,
I was a single guy. Can you imagine if I was married and had children and
yeah.
other obligations, responsibilities? I mean, I didn't been able to do it for like 5 years. So I said to myself, I was hoping, and as I was working at healthcare sector, really digging deep into how do we help everyday employees. When you look at the bell curve of the U.S. population, this is 2020 data, a little outdated, but there was 328 million people. Out of that, 177 million were insured through employees. You had a job, you were employed through a company. When you look at the bell curve, majority of those people made between mid 40s to like maybe high 90s. That's the bulk in the middle. And then, of course, you have people that make a lot more money and that are part time. But those are the folks, the majority of the folks that are really suffering. And God forbid you have a situation where you need a very critical surgical procedure. If you can't afford it, you may have to take out a loan. You know, medical debt in the U.S. is one of the biggest issues.
Yeah.
People have gone bankrupt. They lost their houses
Yeah.
as a result of it. And
Yeah, it's
so
crazy.
we've got to figure a solution out. And so it's something that I feel real passionate about because I grew up in that and I know what it feels like. Um, and even today, I know a lot of people say, "Hey, Jim, I go to South Korea to get my dental work done because I can get my, you know, tooth pulled for like $100 versus whatever I pay here. I
Yeah.
can get, certain procedures done like, implants for a fraction of the US."
Yeah.
But then I say, well, what do you know about that hospital? Do you know a lot about it? Well, no, I just got it through word of mouth.
Yeah,
I'm
that's the
like,
thing,
okay.
isn't it? Yeah,
And that's a little scary. So we want to make sure that when we have people going overseas, they're going to some of the best clinics.
yeah.
We don't want to compromise on that.
Absolutely. Jim, it's rarely plain sailing when you start a business and you're looking to scale and all of those things. We've got a we've got a community of founders that tune into the show, and I always ask this question about how you navigate challenges. What can you share around that?
The biggest challenge is the unknown. You don't know
Yeah.
what you don't know. And as you build a company, you learn new things, you discover new things that you just didn't foresee. Um, our program cost employers zero, nothing to implement. And they have everything to gain because we're there to help them reduce the cost, especially in the area of specialty pharmacy. That's like a no-brainer, right? You got to continue to get that drug on an ongoing basis. And and even then, there's a lot of fear around these programs. Like, can I trust it? And so we're trying to do the best job we can to educate folks, make them aware. And sometimes you just don't know what you don't know. There's a lot of unknowns. There's a lot of landmines you have to navigate through. When you're building a company from, it could be anything from looking at the demand on the side of the market, things that you just didn't foresee, and you have to make adjustments. I really rely on my advisors and investors, our early investors, and I seek a lot of advice. We did a lot of market analysis. We did market surveys to validate our model before we even started the business. And I was shocked. I was shocked to find when I did the market survey, sent it out to just generic 400 people. I think we sent it to. It was like 59 point X percent, almost 60% of the people said they would absolutely do this if these conditions were met that I just mentioned. No out of pocket, full coverage. We'll take care of your visa. We'll take care of your passport if you needed one. We make sure everything's curated. We have a nurse navigator that will talk to you literally 24/7 through the whole journey. And we want to make sure our experience is so pleasant and delightful that when they come back and they're like, oh my God, you know, we want this to be like a personalized experience. So when you get back, how many doctors, I mean, how many people follow up with you, except we may get a call after a surgery, but we have to make sure our nurse navigators does continuous follow up. And the beautiful thing
Concierge
about a lot of the
service.
global surgery internationally is we have the flexibility to say if the patient needs to stay there a couple extra days for monitoring because the doctors want to monitor longer, we allow that. In the US, it's negotiated between the provider and the payer how many days they're allowed to be admitted. And if you're only going to be paying for 3 days of admission, you got to leave. You got to get out of there because insurance is not going to pay for that, whether you're ready or not. And so that's where readmissions, and that's where complications come in. So when you have a system where if a doctor says, I really want to monitor this patient for 2, 3 more days because we allow for that, and when they come back, the readmission rate is so much lower when you look at international than here, and the outcome is so much better as a result of it. And that's what really matters.
Definitely. Thanks for that. What comes next? What can you share that's exciting for the listeners?
Well, I think for us, we just launched our company in June. We just signed our first multi-year contract with a plan administrator. We're starting to make a difference already. It's only been a few months. We're trying to gear up, hire some really good salespeople. But more importantly, the long-term vision, which I don't know how long it is, but our vision is that we want to make curation of surgical specialty medications or even elective procedures as easy as on a platform that you could just go on, and to be able to curate these services and have all of the services available to you literally on your mobile device or your laptop, whatever you want to use. So building that platform is something that we're focused on. We're looking at the future of our platform. We talk about medical record issues. When you go internationally, sometimes medical records are only kept 5, 7 years. We want to make the medical record available for the life of the patient. Doesn't exist today, that service. I don't even know if that exists in the US. I think there's a number of years that they're required to keep your medical records. But, if you're young and you're still in your 40s and 20 years have gone by and you've moved 3 states and you work at a different company, you should have access to your medical records for the life of the patient. That's our goal. And so when you log in, you'll be able to see your history of what you had done, your images, all of your medical records, and have that transported wherever you are or you doctor that wants to see it. So making that capability of available, fully HIPAA compliant. Accessibility to the lowest possible drugs. I mentioned Aphora RX. We have AphoraHealth.com and AphoraRx.com. The Aphora RX is really, we want to integrate into a platform where you can go there. It's a one-stop shop for everything. So you've gotten your procedures, you know all the procedures you had, you know who you spoke to, you got all your written notes from your navigator, you can talk to somebody when you need to. And by the way, we don't charge anything for this because we believe that you should have access to your medical records, and that shouldn't cost you money. That really should be available to you. Now, luckily for us, we deal with lower volumes, because we're dealing with people who had surgeries.
Yes.
And they're much lower volume than the typical medical records where they deal with thousands a day. We don't have that kind of volume, luckily. But so that platform for us is something that it's in the works. We're developing it, trying to hire a great team to continue, but it's all around end user, and the easiness of it. When you buy certain products, you don't even need an instruction manual to learn how to use it. We really want our platform to be that easy.
Yeah.
You really shouldn't need a manual to just log in and get your medical records. Say, you know what, I think I want to get a eye lift, and you'd be able to go there. And when you find a location, it's been curated, you're getting a very good price because it's been negotiated, and you're going to a top-notch facility and a doctor that is trusted. And that's our goal.
Love it. Big vision, super important mission, and really, really great insights. Jim, thank you so much for sharing all that with us. It's all we've got time for, but it's been great meeting you. And I'm looking forward to a 0.20 podcast maybe next year to see how you guys are getting on. But for now, Jim Song, CEO of Aphora Health. That's all we've got time for. Thanks very much.
Thank you, Lee.